Swine flu cases and deaths are rising in New Mexico.
And hospital intensive care units are filling up. Despite that, health authorities said today everyone should stay calm, even with the shortage of flu vaccine. They say the vast majority of people will not get sick. News 13's Dave Bowman is live downtown with more on the wait for that vaccine. Dave?
Dick, representatives of the metro area's 3 largest hospital systems say they have already used up their allotment of the vaccine so far. Most of that has gone to frontline healthcare workers.
A few people in high-risk groups, like pregnant women and small children with health problems, have also received the vaccine. And the next batch of doses will also go to those people. New Mexico is expected to have received shipments totaling 1.2 million doses by the end of January. So when will the shipments of the vaccine turn from a trickle into a flow?
Wish I could give you a date. I can't.
Today, representatives of the metro area's 3 largest hospitals asked an antsy public to be patient. But they're also concerned that by the time the flood of H1N1 shots get here, the current wave of swine flu may have already peaked.
Yes, we still think you should get the vaccine.
UNM's emergency medicine director, Dr. Michael Richards, says there are still good reasons to get the vaccine, even if it's not until January.
We expect the attack rate to be somewhere between 10 and 30%, which means that most of the population won't have had the disease. And H1 will still be with us, and so we still want to do those public health measures like vaccinations.
Meantime, hospital officials say the best we can do while the number of swine flu cases piles up is to keep washing our hands and stay home when we're sick. And don't panic.
It's running its course, and the vast majority of patients the symptoms are resolving and they are returning to their normal activities.
Now, hospitals are hoping that this apparent wave of swine flu peaks soon. The chief executive of Lovelace Hospital says admissions to the intensive care unit are up 40% over this time last year. Back to you.
All right, Dave, Dr. Richards from UNM Hospital said something we probably ought to stress here, that he expects only 10 to 30% of New Mexicans will get sick from the swine flu. In other words, the vast majority of people will not be infected. And again, those who don't get infected, however, should get the vaccine when it gets here to make sure that they are protected ahead.